Ain't gonna let nobody turn me around, turn me around, turn me around. Ain't gonna let nobody turn me around. Just keep on walking, keep on talking, walking in freedom line.
My name is and I'm a board member of the grassroots organization Northside Action for Justice, and I would just like to welcome everybody to our Town Hall Forum on Human Services tonight. We are here tonight because these are challenging times for many Americans. We hear about the growing economy, but some of us, we just can't tell. We hear the stories about SNAP benefits being cut, about Medicaid being denied or terminated. We hear the stories about not being able to survive on minimum wage. So tonight, we will meet and we will hear from the people behind the stories. We are here, the Medicaid recipients, the frontline workers, the service providers, the people providing full-time care for our most vulnerable citizens. We're here to be heard, but we're also here to listen. We want to thank those elected officials that took their time out tonight to come and listen to our concerns and please to respond. Our state senator would like to thank. Our state representative, Greg Harris. And our state representative, Kelly Cassidy. So tonight we have several topics we will be discussing. One topic, put human back in human services. Justice and respect for direct care providers. Chaos from closures of the DHS offices and the consolidation of those offices. And Fund Illinois. So the first panel we have speaking is Ann Crow of Rogers Park, Robert Kramer, a DHS worker member of ASME 2858, and Kathy Powers of Edgewater.
Hi everybody, good evening. My name is Robert Kramer. I'm a supervisor at the Northern DHS office in Spokane, and I'm also a ASME steward. For people that are serviced by the Northern office for the last 2 years, you've probably seen a change in the way we do things, and it's probably made a lot of people unhappy because there's something in DHS that it's been referred by a lot of us as the Ford Foundation plan. It's a new way of delivering services, which is basically chopped up the job. Instead of you having a caseworker, you now see one person, but that person doesn't do anything for you. And so what's happened is the services have deteriorated to, a lot of times people have to come over and over and over to our office because we've lost the documents. And applications get lost, we have to replace them. And this has been going on for a couple of years because basically what the plan is now, you have somebody sees the worker, sees a person that comes into the office, but then that isn't the person that services them. That gets passed down to somebody else who then looks at it and registers. If it's an application, they register it. Then it goes to somebody else who reviews it. Then it goes to somebody else to process it. So as you imagine all those hands handling it, it's not a very efficient system. It's also created backlogs of customers because it's basically doubled and tripled the waiting times in the waiting rooms. Because now instead of having an entire office of customer service representatives, I'm currently supervising the customer relations team. We have about 15 workers or so that are there on a daily basis to service the 500 plus customers that come into the Northern office every day. So so people that have been to our office know that the waiting times are much higher than they used to be. The service has deteriorated, and if you have a question, a lot of times nobody can answer it for you because everything is centrally stored. It used to be if you had a caseworker, they had your document. Did you get such and such? Yeah, I got it. I didn't get it. Do you need anything? Yeah, I need this. We don't know anymore. because we could either search the whole area for the case or just tell you, just gotta wait till something comes and I'll let you know, which is what we do. And so basically, the other thing is that our customers are feeling disconnected because they don't have a caseworker anymore. If they have a problem, they don't know who to call. And our phones don't get answered because we service about 100,000 cases in Northern. We have one switchboard operator and 2 people in the call center. So we have a grand total of 3 people answering the phone calls for an office that services 100,000 cases, which is pretty ridiculous, I think. And so the other thing with that is because people don't have caseworkers anymore, they don't feel connected to the services that we're providing. They don't feel connected to anybody. Even though we've been on this plan for 2 years, they still ask to see their caseworker. They ask for who their caseworker is, and also sometimes they ask for a specific person by name. So it's a real problem as far as the service providing. And this model that has been introduced in our office for the past 2 years is now the model for DHS. For all the offices, the plan is to eventually roll this out for all offices. Not everybody's doing it yet, but the plan is, as long as the current leadership are there, this bad service delivery plan is their plan for the future. Unless somebody steps up and says no to it, they're going to continue rolling it out. And they talked a little about the Medicaid problem, and I think some of the people here may have already been affected by it, which is the Maximus contract, or the Medicaid redetermination project, whatever they call it. Basically, this is a plan to save money. They paid an outside contractor a whole lot of money with the hopes of cutting people off of Medicaid. The result is a whole bunch of people that should be on Medicaid are being eliminated. And the numbers I've seen of the cancellations, between 33 and 40% of the cases canceled as a result of the actions and recommendations from Maximus have to be reinstated. And it's creating a hardship. We have people every day that are coming to our office that have children with serious medical conditions, and they can't get medical treatment because their case got canceled. It's either because they didn't turn a document in exactly 10 days, or they have very inexperienced workers at those offices. They're brand new hires. Most of them are still trainees. And they don't understand the policies. A lot of times they're not applying policies properly, and cases are getting canceled that shouldn't be canceled. And I have personally been involved in quite a few cases already where people have lost their benefits and have children with really, really serious conditions that need medication. They can't get their medication because the case was canceled. And it's real easy to cancel a case, but a lot of cases, especially if they've been canceled for more than a month before the person comes in, they have to be completely set up from scratch as if they never existed. And it's a very time-consuming process, and only a handful of people have access to be able to do that. So I'm hoping that something can be done both about this Ford Foundation plan, which is a very bad plan, and also something about this thing with the redetermination project, because cases are being canceled unfairly and it needs to stop.
Okay. Thank you very much.
My name is Ann Crow, and I am a Medicaid recipient. What Mr. Kramer said about the dehumanization of human services is exactly on point. What happens when you go, if you've never been to the Department of Human Services, what happens is you go in and you wait online, sometimes for a half hour, and then you go up to a person and they put your name in the computer, and then they tell you to sit down. And you can sit for up to 3 hours, just sitting there, waiting to see someone that you don't know. This is the caseworker problem. I have had the caseworker in the past, but every time I would go to the office, it would be a different caseworker. And I think there's someone in the audience that knows this, because she is a caseworker there. And I've spoken to her about this problem. Without a caseworker, you do feel disconnected from the system. There's nobody who really knows you, nobody to see, when you go there, you don't know who you're going to see, you don't know who has your paperwork, and you are feeling very like nobody knows what you're going through, and it's true. There's no continuity to the services. Every time you go there, it seems like it's a whole brand new thing. And when you don't have a caseworker, it's really hard to understand like different things like spend downs. I've been trying to find out why I have a spend down for months now. It's been months. And every time I go there, I speak to someone different who tells me something different. So, and it's not the people who work there. I think they're doing their best within the system. It's a systemic problem. It's the way that things are set up now. As Mr. Kramer pointed out, it's a team system. In other words, your paperwork goes to a particular team. If you have a spend down issue, your paperwork goes to the spend down team. Supposedly goes to the spend down team. And you really don't know what has happened to your paperwork. The last time I was there, I couldn't do it. I couldn't wait online. I couldn't sit there for 2.5 hours. So I put my papers in the drop-off box, which is a joke, because when you put your papers in the drop-off box, you don't know whatever happens to them. My papers have been in the drop-off box for a month now, and I never heard anything back from Medicaid as to my spend down. They were my spend down papers. A spend down is like a deductible, an insurance deductible. You have to spend a certain amount of money in order for your Medicaid to kick in. So I had all my bills and everything in order, and all my paperwork in order, put it in the drop box. Who the heck knows where it is now? I certainly don't. Okay. And the phone, as Mr. Kramer pointed out, the phone, I have to laugh because I've tried to call and it's impossible. You can't get a message through to anybody. And because you don't have a caseworker, you don't know who to call. You don't have a message to give to a particular person. So what I'm asking, and I think what a lot of people would like to have, is the old caseworker system where a person has a number of cases where they see you, where they know you, you know them, and we can interface directly with the department. And that is what I have to say about the Department of Human Services. Please humanize it for us. We need it.
Thank you.
My name is Kathy Powers. I'm on the steering committee for the Alliance of Community Services and a board member of Northside Action for Justice. I live with bipolar illness since the age of 11, and I thank goodness that I have both Medicare and Medicaid. I sincerely believe that the 4-drug limit be abolished. I take 20 different medications a day to survive. If I had to choose only 4 medications, I'd have to choose losing my kidneys, my thyroid, my GI tract, my perennial rhinitis, the chronic pain that goes along with the 5 fusions in my back, my liver, suffer Parkinsonian symptoms, suffer movement disorder symptoms that are side effects from the psychiatric medications that I take, which cause me to bite my mouth spasmodically, and I have bruises all over on the inside of my mouth. That's just part of what they call tardive dyskinesia, which is a result of very strong psychotic medications. I have diabetes, and of course I have to take my psychiatric medications. And, which four will I treat, which four, what, and everything else just goes out. When the rules change for dual eligibles, people who have both Medicare and Medicaid, which is very fuzzy right now, the reality of medication limitations looms further. When the well-intentioned prior authorization process was added, there was some hope to obtain sufficient medication. Unfortunately, the prior authorization process yielded unworkable results. Persons at my C4 drop-in center had their medications denied. The reason for the medication denial? Denied. That was the reason. Denied. Another reason. Denial was already approved. Denial because the drug was already approved. That was from a girl who received a certain amount of medication twice a day, for years. Somewhere along the line, it got denied. So when she appealed it, they said, it's already been approved, so we're denying this appeal. It caused several months of hospitalization in frustration. She cut herself from head to toe. She had to be months in the hospital, recovering from physical illness now from the cutting. And of course, she received her medication, her psychiatric medication in the hospital, so she did better. And I'm happy to say she's back at the drop-in center. I'm really glad to see her. This authorization process is broken and it's dangerous. When one takes medications, as I do, it affects your dental health. You have a dry mouth and your teeth. I have a little thing here. I have no teeth on the bottom at all. I have these 3 teeth, and now my top teeth are coming out. I need dentures, and I'm not going to get them because I have no way of paying for them. Because of the poor dental health, I have a heart risk problem. So since prescribed medications prevent medical emergencies, hospitalizations, and lower doctor visits, I think Congress would be wise to consider the cost savings by removing the limit of the medications allowed. Just as an economic boost to the Medicaid economy. As far as dental health benefits goes, I'm sure I'm not the only one who is at risk for cardiac disease or a choking emergency or death because of lack of dental care. Thank you for your time.
I know that in my office, one of the largest number of calls we get about is concerns that people aren't getting enrolled, they're not getting their cases taken care of in the Human Services Department. And my staff has spent a lot of time trying to help navigate that. So first, we're always, we and our staffs in our office are always here to try to help people navigate because we know how overwhelmed they are in the offices. We have been working to authorize getting more people hired. We have in the budget this year hiring more people, and my understanding is that they're having a hard time bringing on enough people, and that we really need to keep that up. We know we need more caseworkers on board. I want to find out and go and visit and understand what the Ford Foundation plan is. I don't know what that is and what they've moved away from and getting back into caseworkers. I think makes sense that you know somebody there. I totally get that, so I'm glad to learn about that. I look forward to digging into that. Some of the other items, the Maximus contract itself, AFSCME successfully did work a court case on that, so that is getting scaled back, what Maximus can do. So now it does have to be, it's very clear that it has to be DHS caseworkers who have to do this enrollment, so we can have confidence that at least it's people there who know what they're doing who will be making those eligibility determinations. Just to give you context about that, I know some folks here probably know why that happened, others don't. When we have a huge state budget problem, and you guys, you're going to hear this through different panels throughout the night, because I'm personally very, very concerned about the state of our budget and where revenues are going to be coming from in the future, because we're going to be facing more cuts if we don't do something on the revenue side. And we already are hearing and seeing and experiencing how problematic it already is. What I would say that when we were sitting around negotiating around Medicaid because of our budget crisis, that was one of the sticking points the Republicans would not give up on, was doing the Maximus. And they really, and you hear this from every Republican gubernatorial candidate out there, think that the way we can solve all the state's budget problems are getting people off Medicaid who don't belong on Medicaid. Well, clearly that's not the case, and we just kick people off who really belong there. So we really have to address what's going on the revenue side. And then the other point I'll make quickly, turn over to these guys, is on the for prescription, it's not a limit, it isn't prior authorization. We are looking at ways of trying to make that work better. Everybody should be getting the medications they need, and if they're not, we really have to make sure that's not the case. And in dental, we're trying to restore the dental benefits that were cut. We passed a bill in the Senate. These guys I know support it in the House, but we don't have enough ability to get it out of the House yet. But we're really working on that. So we're going to keep fighting those fights, and we're going to need lots of help on it. And we're going to continue to have revenue challenges, and we really need everyone to help us with the revenue side too.
A lot of what Heather said is a great deal of what we feel as well in our office. To the issue of the Ford Foundation plan, it is something that we actually found ourselves deeply engaged in because of complaints we were getting from customers in the North office, in the Skokie office. Throughout last summer, my staff and interns and I made surprise visits to the Skokie office. We took pictures of bathrooms without doors. We heard stories of toilet paper rationing in other offices. We collected nightmare scenarios of phone efforts at reaching the office by phone, and took all of that data. We actually called every day at varying times of the day and kept track. We kept voluminous records of our efforts to make contact, and had a series of conversations with the secretary and staff of DHS to attempt to address all of the issues. The bathrooms do have doors now, I hear. There's no more toilet paper rationing happening in other offices. The initial fix for the phone problem actually made things worse, but I'm pleased to report that our most recent round of calls, we actually had 3 out of the 5 numbers answered by a human being today. So there is improvement. It's pretty good. And in one case, we actually had a constituent who's got an ongoing problem get an answer. We had her call with her problem and get an answer just to sort of test the system again. To the caseworker issue, though, we've had several conversations with leadership at DHS about the problem and about really using the same language. This is not human services. That we're not treating folks like customers. We're not treating them like human beings, and that this effort at efficiency is not only not efficient, it's inhumane. And so we have pressed that message and continue to do so, and have pushed very hard for this not to be expanded into other offices because it isn't working. I am supporting efforts to make the for-drug guidelines more accessible to folks, in dental in particular. It's something we hear from folks a lot. We spent a lot of time trying to get folks access to alternative ways of getting care. In fact, we've had the Skokie office make referrals. If you call Matt Muir in Kelly Cassidy's office, she can take care of your problem. So we jokingly refer to him as the additional Skokie caseworker now. But we do. It is so good to hear the real stories and really to be able to point to someone as an example of what needs to be done differently. So please keep bringing us these stories and let us help you as much as we can.
Okay, my name is Greg Harris. I'm a representative of the 13th District. It's Uptown, Ravenswood, Lincoln Square, Bowmanville, Westbridge, just to the west and the south of us. To give you an idea, I chair the Appropriations Committee in the House, under which the Department of Human Services, Healthcare and Family Services, Aging, DCFS, DOORS, Veterans Affairs, and Public Affairs get their budgets. And in the Senate, Heather Steans is the chairman of the counterpart budget committee for the Senate, the Appropriations Committee. So, I mean, between us, the decisions that guide the agencies you're concerned with tonight, this is where they get made. So we're really glad, I think, to hear hear directly from you about these things, but I'll just go back to what Heather started with, is that if we do not fix our revenue problem as a state, if we do not get a graduated income tax so that the wealthiest people in our state are paying their fair share, if we do not close corporate loopholes so that these companies which right now are not paying any income taxes, all we're going to be doing amongst each other is scuffling for the crumbs. And that's not where we ought to be. And I got another meeting I got to go to, so I just wanted to plug. The most important thing we all need to do tonight is look at new revenue, because if we can bring in adequate revenue to pay for enough people to serve our customers in the DHS office, or pay a living wage to our home care workers and our nursing home workers, and we need the revenue to do it. So that being said, let me just talk to some of the really excellent points made by the panel. And to the folks from ASME, who are working in the offices, and to Anne, who has to go there. The name of that office is Human Services. So service ought to be the driving thing that people go in there for. It should not be automation. It should not be fill out forms. It should not be standing in lines. And we need, I know Ann knows me, and if you have a problem, call me, call Heather, call Kelly. We need to track some of these individual cases to be sure that the folks are getting dealt with appropriately. As far as the redeterminations, we did add 600 new employees to the DHS budget this year to begin to pick up on the processing of applications and redeterminations of SNAP, of Medicaid, of dual eligibles. We gave some extra money to Cook County, but there are still hundreds more workers needed to keep up with the workload that's before them, and that's something we need to attend to with our colleagues. I think I would join these guys saying, we were opposed to the whole idea of Maximus, the hiring, outside companies to go through our Medicaid rolls. Probably isn't the best idea when we should have, folks within state government, who know our systems and know our people doing that work. So I think we support keeping that within the department. As far as some of the questions on the prior authorization and the dental health, I met with the Medicaid director this Wednesday for a few hours, and I asked her, I said, you need to get us now that this has been in effect for a year or two. I want to see some data. What are we paying in additional hospitalizations for people with diagnoses like mental health problems of different kinds, whether it's schizophrenia or bipolar disorder or other severe mental illness? What are we seeing with emergency department visits? What are we seeing with inpatient visits? What are we seeing with diagnoses related to dental problems? Because I will bet you that if we look at those figures, we're going to find out that while we're trying to save money, we're spending money to do it, which doesn't make a whole hell of a lot of sense. And if those numbers are there, then we need to work with our colleagues to educate them on those facts and restore the services so that we're doing prevention. And we're working with people like Thresholds and 4Cs and folks like that to gather this information so that we have validation from both sides. So I think that's what I'm going to say. So.
We will be closing out with a song.
Ain't no